Hello, this is Aaron Shoemaker, and I'm here with your bi-weekly update today regarding our sleep apnea clinic and a new technology in the WatchPat sleep apnea testing system. Dr. Vora, why don't you tell us about yourself a little bit?
So I started out with pulmonary critical care and sleep medicine, and have been practicing this here for the last about 19 to 20 years. And as the three specialties have grown, especially sleep, I'm focusing more on sleep medicine and developing that in the system.
Great. Well, tell us about what your practice has become now.
So essentially what we do is, we have a sleep and pulmonary office, and we screen patients for sleep apnea. We also obviously treat sleep apnea, so we screen, arrange sleep studies, do the sleep studies either in inpatient or outpatient type setting, and then follow up the patients. Measurement for compliance has become very, very important, both for entities such as commercial drivers and certainly for patients with complex diseases like heart disease and pulmonary disease.
Great. Where is your clinic now?
My office is on NAB Road,
Okay.
8330 NAB Road is Suite 340.
Great. Well, let's talk about the new piece of technology and the star of the show today, which is the WatchPat system.
So the WatchPat system is a system that is very compact, and this actually is the entire system as you look at it. And this is a device that has been around for many years, is FDA approved, and has been used extensively in many different systems. So this is a home sleep testing system, and the beauty of the system is that it's very small. There's nothing on the patient's face, and it's very easy to administer for a patient at home. The technology that records and gives you the diagnosis is based on the arterial tone, the peripheral arterial tone. That's where the PAT comes from. And watch is because this goes on your wrist, so it kind of looks like a watch.
Right.
And this goes on your finger. So you have this on your finger, which collects all the data. This is then transferred from here to the device. And this is a microphone and an accelerometer, which records your snoring level and the position that you're sleeping in. So there's nothing on the patient's face, very easy to administer, and most importantly, it can be given right out of the physician office. And insurances are covering for it, so it makes sleep medicine and sleep apnea diagnosis local.
So this is a fully functional diagnostic sleep apnea test, and it can be delivered from the office level.
Correct.
Excellent. So how would we go about getting one of these today?
So if you want to get a WatchPat done today, there are a few offices that are beginning to do that. My office is doing it. Dr. Shoemaker's office is doing it. Cardiology is beginning to do it too, and gradually we're going to roll it out to any office that is interested in it, and several physicians have experienced interest in it. So what you do is you go ahead and put the order in Athena, and we'll route the order to the right place for the study to be done. Currently, we are beginning to schedule right out of our office.
So we would order a sleep study and then direct it to you specifically, or for a WatchPat?
Yeah. So what you would do is when you put in the order, you put in the order as WatchPat, and that is separate from polysomnogram. That's separate from a home sleep test. And when you go into Athena, go into your order section and put in WatchPat, it will pop up as a separate entity.
Excellent. So if I wanted to order a test for a patient today, it might take 3, 4, 5 weeks to get that patient studied. How long would it take a patient to get this if they came to your office and picked it up?
So if they pick this up, then you are looking at, you put the order in, the order goes in, you'll probably get a patient will get a call in a day or two to come in and pick up the device, or maybe 3 days because we have to pre-authorize the patient. So the pre-auth can be done in about 48 to 72 hours. Patient picks up the device, goes home, does 1 or 2 nights, brings it back, is downloaded the same day, and it's probably read the next day. So between getting the order out from your office to getting the result would be probably about a week. Getting the test done would be about 3 days after the order.
Fantastic. So these are the things we want to try and bring you, are new technologies, new things that are happening. If we can improve the time to a sleep study from weeks to 1 week, I think that benefits our patients and takes a lot of frustrations away at the office. I know that happens in my office currently with sleep apnea testing. So takeaways today, we have new home testing options with Dr. Vora and the WatchPat system. It's faster. Eventually it can be locally distributed. Please utilize this service. We're excited to offer it to our patients. Lastly, I wanted to put a plug in. There will be commercials for our sports medicine program on the Olympics. It's a really cool video, so I wanted to share it with you. It will be a second link if you'd like to watch it. It's just 30 seconds. It shows you what great services we have at sports medicine in St. Vincent's, and I'd highly encourage you to use those services as well. Thank you.